Independent pharmacies should focus on foot care because there isn't that specialist help and products available in the community. We are the only place that they can get that. OTC business have been neglected because everyone focuses on their NHS business. So they need to come out of the dispensary into the retail world and look at retail health. When people go out looking for foot care advice or products, they're not getting the full range that they would do in pharmacy. So I personally have walked around the town centre to see what's available. So the basic things are available, but specialised help isn't available. And that's why pharmacy is important. So the way to build a marketing strategy is to know about your community. The challenges of the marketing strategy is that it is hard work, but the return on investment is worthwhile. So spending that extra time finding out what is needed gives you good return. From our research, what we found out is that the clients and the customers would like everything in one place, like a health hub. So what we've created is clinic rooms where we have external practitioners that come in, and one of them is a chiropodist. So the foot healthcare practitioner looks after those clients and then comes out, hands over to the pharmacy team, which then we give them the choice of different accessories and foot aids that will complement with the clinic that we do. Good merchandising is very important because it's the impression you make to the community. What I believe in is having everything face pulling forward. Manufacturers and companies spend a lot of their time designing their front pack. So showing that off is very important. Immediately when you walk through the door, there's an access way, and there's also, you can see directly to one of the pharmacy team. So that eye contact is very important. But as you walk through, you will see signage that will tell you where things are. It will display the different services that we do in this pharmacy. So to make the pharmacy visually interesting, it's using the right combinations of colour as well as being pulled forward and looking neat. Now this is a pharmacy team effort. It's not just me, the whole team do it. So we all take pride in our pharmacy. GPHC standards are very important, especially Principle 3. Principle 3 looks at the environment of the pharmacy to make sure the community and patients are safe in this pharmacy. So part of that principle is to display your survey results, your responsible pharmacist display, at the same time making sure everything is kept safe. With regards to the roles for merchandising, every team member, including me, has to look after the merchandising. So if we're walking past and we see something not pulled forward, we will pull it forward. If anything's misplaced, we will rearrange it. So everyone has that ownership and responsibility. On a day-to-day basis, the front of house team, they're the ones that will look after deliveries that come in and make sure things are promptly put away. And at the same time, they're put away in the right places. Keeping staff up to date is crucial. Without them knowing what's happening and being trained on a new product, they're not able to build your business. So it comes from you directly. You must engage with your pharmacy team, make sure that you're giving them the tools such as training, as well as giving them the tools to use social media to promote pharmacy. So Gap Attack is, you could pretty much call it like a game where you go around the store, and if there are gaps, you take other stock to fill that gap. And at the same time, you work out why that gap is there. So you can then look at your ordering and fulfill those and make sure that you're fully stocked. There is value to in-store promotions. Two factors. One is to look at price choices, but the other is the value that we give as pharmacy to the community. So it may not necessarily be a price conscious promotion, but it could be a promotion on linking health. So if someone came in, say, for foot health, but at the same time, we're giving added value with having a chiropody clinic. The Foot Zone is a unit that allows for the team as well as the community to map their way through foot health. So it's cleverly merchandised with signage and as well as information to make it an easy guide to help select a product. So when people come in to buy something for their feet, what we tend to do is just ask them about their general health as well and link sales accordingly. So just because someone's come in for something specific doesn't mean that they don't need anything else. It's important to engage with them, question them, and at the same time make sure you're finding solutions for what they've come in for. So taking Foot Care as an example of marketing externally within the community, we've done diabetic health checks for our community. At the same time, our chiropodist has come along with us as a part of the pharmacy team. They've given advice on foot health and told them that the pharmacy is the place to get their foot care products. The media that we use are in various formats, so we tend to look at social media as one of the active engagement within the community. At the same time, we look at the local media, so the local papers, local radio. We have good connections with them because over time we've built those relationships. So anything that's unique or different or something new that comes into pharmacy, we give them a press release and then they come in to pharmacy to interview us. So social media is all about engagement and interacting. So the platforms that we have set up are Facebook, Twitter, Instagram, and we're now trying Snapchat as well. Pinterest is another one that's becoming very popular. What we are getting into, and nationally seems to be the one that works, is YouTube clips. So visually, that's more engaging. Networking is very important, not just with other healthcare professionals, but also networking with your community pharmacies in the same area. The good thing about working together is you can get staff training done together, marketing done together, and that way we can promote pharmacy as a whole. The Salvia Health Group in Dartford, Grayford and Swanley is a collective federation of pharmacies, especially independent pharmacies within this area. What we do together is to promote pharmacy to the community. We also build the standards in our pharmacy by doing training for the whole pharmacy teams of all the Salvia Group.